All right, welcome everybody to this week's tip. We're going to do something a little bit different for you. Now, I've been giving you a lot of tips. We've been going through the 5 ways to handle this, the 3 things to improve that, challenges. But this week, what I want to do is I want to play some new patient phone calls for you and talk through the wrong way of handling a new patient phone call and thereby giving you possibly the right way. There is a bit of a challenge too at the end, of course. Can your office do any better and take us up on a mystery call? So the first thing we're going to do is talk about the new patient phone call. Now, I'm going to play 2 calls for you. In these 2 calls, I want you to know that we pose as a price shopper. I have heard awful things about price shoppers. People that are shopping around, they're going to leave you too. They're just looking for the lowest price. And some of that is true. Sure, could be. But in 80% of price shoppers that I had come to my office, most of them, 80% of them are sold on dentistry. They're just not sold on the dentist. So if I can get that patient into the practice, then I have a good chance of getting them to take our service. All right, so what we're going to do is play the first call. We're going to listen to it, and then we're going to discuss it. Here we go.
Speaking, how may I help you?
Hi, is that the dentist office?
This is the dentist office. How can I help you?
Okay. Do you see patients that don't have dental insurances? Are you allowed to see patients? I don't have any dental insurance. Do you see patients without dental insurance?
We do. You'd be paying out of pocket. Are you having an emergency?
Not really an emergency. I went to a dentist last week, and he told me that I needed to get a crown, and I was just kind of calling around, wanted to see the different,
We don't give fees over the phone. I'm sorry.
Okay.
Okay, thank you.
Okay.
Bye-bye.
Okay, so, well, that's, I don't know what, there's not much to say that you probably aren't already thinking, right? But let's be objective about it, right? Like, the call is pretty bad. There's a couple things we're looking for. Is the call picked up in a timely manner? Yes. Okay, now, guys, this call, I've given out many tips about how to answer the phone. This call is so bad, I don't need to bleep out anything when it comes to the greeting. I don't know whose office this is, and I don't know what that person's name is. The standard greeting is out, so that's kind of a fail. If we look at, was I put on hold? No. So that's good. That's a positive. But to be fair, I didn't have enough time. The person couldn't wait to get me off the phone. When we're listening to a new patient phone call, what we're listening for will be the ability to take control of a conversation, to get your information, and to attempt to schedule somebody. So if we go through this in order, did they get my name? No. Phone number? No. How I heard about the practice? No. Were they interested in me? No. This was a fee-for-service patient. Yes, they're calling around about pricing. To be fair, whenever someone gives us a price, it's always cheaper. We're always giving them the ability to get us in. The person on this phone call didn't even attempt to schedule and really just hung up. That is a crown. Now, if we would have gotten into the conversation, what you would have found out is that we want the price of a crown, but I really needed 4. And so what's that worth to the office? This is an example of an office not scheduling an interested patient. I'm going to go through another call and show you how it can get possibly worse. So I'm going to play the second call for you, and we're going to talk about it. Are you ready? Here we go.
Dental office.
Oh, hi. I was calling to see how much you guys charge for a crown.
Our crowns are $13.50.
$13.50. Awesome.
Uh-huh.
Now, do you guys have any discount for like non-insurance?
We don't. Not at the moment. We sure don't.
Maybe a bulk discount. I need 4. I need.
That's something. I mean, I can't authorize that without Dr.'s approval. So we would just have to get you in here for an exam to see. So.
Okay.
Okay.
How do you guys do those invisible braces?
No, you would need to go to an orthodontist for that, or my dentist in Paris does it.
Your dentist in where? Paris?
The name of the office is My Dentist.
Oh, I see.
They do the Invisalign over there.
Is that specifically just a would you call it an orthodontist?
No, it's a general dentist, but they do the Invisalign over there. We do not do them here, but they do them over there.
Oh, you do. What's their phone number?
I don't know. You'll have to just Google it. I don't know what their phone number is over there. You'll have to just look it up.
But it's called My Dentist.
It's called. Yes, My Dentist in Paris.
In Paris, and they do all the crowns and the ortho.
Yes.
So they're the guys to call. I got it.
Yes.
Okay, good. I'll give them a call. Thank you.
Okay, that sounds good. Thank you.
Bye-bye.
Ooh, difficult to listen to, right? In this call, I pose as a patient that needed Invisalign, but found out I needed 4 crowns. I have no insurance, and I want to come in. Now, this office doesn't do Invisalign, but they gave me the price of $13.50, and I was, okay. And once it was found out I was a price shopper, you could hear that just wanted to get me off the phone. Now, that could be for many reasons, like don't know. And when I play these phone calls for doctors, they find reasons why the call was okay, why it was good. But it's not good, and it's not okay. This is all of your hard work. This is all of your training. It made the phone ring with $5,200 worth of crowns that we just sent to another competitor. So it can get worse, guys. We could chalk up bad days to staff. We could blame it on the rain or the schedule or the cyclical cycles of the moon, whatever you want to blame it on. But you're not training your staff properly on how to handle new patient phone calls. And this is what's going on in 99% of the practices. I can count on my 2 hands how many times I did this new patient call and they passed it, like I would have made an appointment. Do you guys know that of the 10, 7 of them were corporate offices? I just had no idea. They put in the request, I made the phone call. One of them was so good, they actually got me on the schedule. I was trying hard not to get on the schedule. They're fully trained. And when we listen to calls like this, we can be objective again. Was the call picked up on 2 rings or less? I think so. Sounded like it. Did they say their name and the name of the practice clearly? No. Another standard greeting out. At least I wasn't put on hold. They didn't get my name, my phone number. How I heard about the practice, super important. And why am I calling? There's very little interest in the patients. There was mention that I needed an exam, but didn't try to get me in. So this is a $5,200 case gone. If you do Invisalign, it's a $10,000 case. Patients that are shopping around are sold on dentistry. They're not sold on the dental office. So these are just 2 calls. And maybe they're the worst. They possibly are. Probably are. But I could play another 8 for you. They would be just as bad in their grading performance. And the only difference would be they're pleasantly not scheduling me. They're very nice. They're very pleasant. And to be fair to every staff member that picks up that doesn't sound pleasant, I don't know what type of day they're having. It could be a bad day. But it doesn't matter. You got 1 shot at handling a new patient. That's it. And this is typically how new patient phone calls go. They miss getting those 4 crucial pieces of information. They don't answer the phone in a timely manner. They don't say their name. They don't say the practice name. All the pleasantries of greeting a new patient in, which we love new patients, gone. And so all of the doctor's hard work, effort, energy, training, wasted. And the worst part about a mishandled new patient phone call is you never hear about it. When I review these calls with doctors and I play them, I ask them, did you hear about this new patient phone call? No. If they had picked up the phone, do you know what most of them would have said? I would have sent an Uber out. I would have went and picked them up. We get this idea that they're all just price shoppers, but a lot of patients are just clueless on the subject of dentistry because they're not dentists. And now they're trying to be sold dentistry at a front desk within 7 minutes, and they have questions, and so they go out and price shop. I love price shoppers. They're my favorite. And if you can handle that on the phone, you could get them in front of you. And if they come to my office, come to your office fully trained, we are going to sell and get 80% of those patients to take your treatment. That's what we do here at MGE. So this is a tip. We want to be able to listen to these phone calls. We want to find out how we're doing. We want to get the 4 pieces of crucial information. But the biggest tip is you have to find out. So take me up on it. I've got a link in the description. Free mystery call to your office. I'll do it. My team will do it. We'll play it for you. We'll review it. And we'll find out what your office is doing well. And there are a lot of things that some offices do well, guys. So they're not all like this. But the majority of them don't do the crucial things correctly, and it leads to no new patient. So find out, sign up, let's do one. Thanks for following me on this tip. Listen to these phone calls. It's cringy, I know, but that's what's happening. If you like this, click the subscribe button on the bottom. There's a lot more tips that we're going to be sending out in the next year here. So follow us, and thanks for tuning into this tip. See you next time.